Why did I become an oncologist? When I started my training, in fact, even prior to that, like many other families in the world, actually, my family was affected by malignancy as well. Some of the most influential people in my life, unfortunately, succumbed to the disease. That wasn't actually the reason why I became an oncologist. That's typically the common answer that you get. It was purely for interest. I remember starting off my residency, that's the one thing I want to do from the very beginning. There's so much about cancer we don't know. I mean, we pour billions and billions of dollars into cancer research, and even to this date, we don't have a cure for some of the most common stage 4 malignancies out there. So it was purely the interest that piqued it initially. But if you ask me that question now, it's different. When you open the door to a patient's room and you're greeted by a warm, smiling face, happy family members, you become a part of their family. They treat you like family. You go through ups and downs with the patient. Every time I see that, every time I see a happy, grateful patient, there's nothing in the world that beats that feeling. So that is my answer every time. Every time I'm going through that, I will always tell myself, this is why I became an oncologist. It's priceless. It's like a challenge, honestly. How do I make my patient's life better? How do I make them spend more time with their family? And I can give you so many examples. They're literally everyone, even if it's for a short duration. The impact that a medical oncologist can have, not only on the patient, but their families, it's tremendous. I have patients who will call me to see if they can take an aspirin. And the reason for that is because that's the level of trust they have in you. There is always hope. It depends how you look at it. Hope is important. If there is no hope, nobody would take any treatment. So hope is important, but then at the same time, realistic hope is even more important. Everybody here, of course, my colleagues, they go the extra distance. And I know this from a behind-the-scenes perspective. They will go the extra distance, make the extra phone calls, do the extra, go the extra yard to make sure that they're providing the best quality of care. And that's what I'd like my patients to remember me by too, that I provided the best quality and I cared. So that's how I'd like them to remember me.